the previous modules, we have seen that medication plays a central role in the management of ADHD symptoms. However, studies show that the persistence of functional impairment is seen in at least a subgroup of patients, even if they take medication. There is also the question of the compliance with the pharmacological treatments. We know that a substantial percentage of persons with ADHD will stop their treatment at some point, and some patients will refuse to take medication during their life. So there is really the need to develop alternative or complementary approaches for the management of ADHD symptoms. This even more so because some studies conducted on adults with ADHD show that they are more satisfied with their clinical care if medication is combined with behavioral intervention. So there is really this need to develop this behavioral intervention, but the guidelines are relatively scarce in this domain. In the previous module, we have seen some of these interventions, such as psychoeducation or psychotherapeutic intervention, that are targeting the knowledge about ADHD and also the intervention on core ADHD symptoms or associated difficulties such as low self-esteem or low mood that can be associated with ADHD in some people. So in this module, we are going to cover a set of interventions that are more oriented toward the reinforcement or the acquisition of skills. For example, we know that attentional or executive dysfunctions are core in the clinical presentation of ADHD. So we are going to talk about cognitive remediation to see whether this is efficient in the context of ADHD, sometimes alone or in combination with other types of intervention. Another example is the question of social skills, because we know that social skills are often impaired in the context of ADHD, and we are going to discuss the potential usefulness of social skills training. So let's go and discover this interesting module.